Yeah, there we go. Perfect. Yeah, so it's going to be recorded today and for everybody to watch at a later date. We have everybody on mute and questions, you can put them in the chat box and we will get to those just at the end of the presentation. And yeah, so I see some more people coming into the webinar, so I'm just going to admit them. Okay, here we are. Okay, and today I am here with Dr. Shelina Babul, and Dr. Shelina is a clinical professor in pediatrics at the University of British Columbia and a director and sports injury specialist at the BC Injury Research and Prevention Unit. And yeah, she is here to kind of give us a presentation and overview on concussion. So yeah, thank you so much for joining us today, Dr. Babul.
Thank you so much, Sarah, for having me. Can you hear me okay?
Yes, it's great.
Okay, perfect. Thank you. It's really a pleasure to be invited to speak to you today about what I call an invisible injury, but a precarious injury because it's a whole lot of gray and just not black and white. And I'll hopefully try to explain through my talk why I call it a precarious gray injury. So again, thank you for having me, and especially during Concussion Awareness Week. Every year, Ontario has enacted Rowan's Law Day in honor of the death of Rowan Stringer in 2013. If you don't know, Rowan was um, had multiple concussions over a short period of time and unfortunately died. And through a coroner's inquest, there was 49 recommendations that were recommended, and one of which was now Rowan's Law Day, which involves immediate removal from player activity and then education into the schools. As well. And the other provinces have followed suit, and they either have a day or a week. And in BC, we have a proclamation by our provincial government, and we have a week, and activities happen all week long, one of which is this presentation. So thank you very much. Oh, no, there we go. Here we go. So before I begin, I want to acknowledge that the BCIRPU offices are located on the traditional lands of the Salish people, including the Squamish, Tsleil-Waututh, and Musqueam nations. We give thanks as uninvited guests on these unceded lands where we live, work, and play, and are very fortunate to be able to do so on these lands. As a family who immigrated to Canada in the late 60s and early 70s, my family, we were taken out of our lands of East Africa, so I full well appreciate what is happening in our country to acknowledge the Aboriginal peoples. So before I begin, I wanted to disclose that I have no financial interest in my program of research. My concussion program in particular, is funded by multiple partners, including the Ministry of Health, the BC Children's Hospital Foundation, Child Health BC, PHSA, and the Public Health Agency of Canada. These aren't constant funders. They have provided funding along the last decade or so I do want to ensure that I acknowledge everybody who has been involved. The program receives in-kind support from the BC Injury Research and Prevention Unit in the form of quarterly reviews, maintenance, and long-term sustainability of the concussion awareness training tool, which I will address later in my talk. So again, I have no potential conflicts of interest. So let's begin. How a concussion is handled in the minutes, hours, and days after injury can significantly influence the extent of damage and recovery from this injury. If you sustain a concussion, you immediately don't take the right steps and you continue to participate in activity, you are now 3 times more likely to sustain a second concussion, potentially more severe with more symptoms. And again, if you don't recognize that second concussion and you continue to play, you are now 9 times more likely to sustain significant brain damage and, in rare circumstances, possibly even death. And I alluded to Rowan Stringer, and that's exactly what happened to her. She sustained a concussion in a rugby game. It wasn't immediately recognized. She played again. It wasn't recognized. And it was her third game within, I think it was a span of 4 or 5 days. she took another hit to the head and unfortunately immediately went into a coma and never recovered. So we want to raise the level of knowledge and awareness about this invisible injury. And it's everyone's responsibility. It's not just the individual themselves who is going through a concussion and the symptoms of a concussion. It impacts everyone around them from their, depending on their age, their parents, their caregivers, school professionals, if they're in academics, if they are employees, it affects them and their employers. It affects individuals, women support workers who deal with intimate partner violence. So it affects everybody. It's a holistic community that is affected by this injury, and we want everybody to know how to recognize and respond and manage this injury. Depending on who you are, what you need to know is very different. So we want everybody to be knowledgeable about concussions. In terms of the burden of concussions and TBI, globally, the economic burden is about $400 billion annually. Now, that's mild, moderate, and severe injury, with an annual lifetime cost that involves 31% towards medical treatment and 69% towards loss of productivity, work, for instance, being in the workforce. And concussion is among the top 5 reasons for workplace time loss in Canada. So I argue, concussions are on the mild side of injury. And I argue that for the small percentage, for the 30% who may have persisting symptoms, it's not mild to them by any means. So I always want to preface that it may be considered a mild traumatic brain injury, but to some, it certainly isn't mild. In terms of the perspective from Canada, it can happen to anyone, anywhere, anytime. It's not just a sport-related injury. It can happen from a motor vehicle collision. It can happen in any sport and recreational activity. It can happen falling on the sidewalk, for that matter. So it can happen at any time. We've had people who've hit their heads on the kitchen cabinet and who are out for months and months and months on end. So it's a very individual injury and can happen at any time. In Canada, there's about 450,000 concussions that happen annually, and primarily in children and youth. But this is an underestimation. Depending on what province you're from, we don't capture the full breadth of injuries. We don't capture the ones that are not recognized and treated. We don't, in BC, we don't capture the ones that go to the physician's offices. We don't capture the ones that walk into walk-in clinics. So I just want everyone to know that this is an underestimated figure. And I address this issue that is it mild for those with persisting symptoms? People can't function and can't understand why they can't function in their daily lives. So I argue that, in that 30% of the population, it certainly isn't a mild injury. So what is a concussion? A concussion is a brain injury resulting to a blunt impact or other mechanical energy applied not only to the head, but to the neck or body. So it is essentially your brain bouncing around inside your skull, whether that's a body check in hockey, whether you get, if you're rear-ended in a motor vehicle collision, it's that whiplash type motion. And again, it can happen from motor vehicle collisions, a fall, sport and recreational activity. It can happen in the workplace and as well in cases of assault and intimate partner violence. It results in either an immediate and temporary altered brain function. Signs and symptoms can appear immediately, but they can appear subtly and you'll have an onset up to 2 days later. So that is a very important point, and I'll address that in one of my next slides. So let me show you
A hard blow to your head can cause your brain to strike the inside of your skull. During the impact, your brain squeezes against the inside of your skull, sending shock waves through your brain. These shock waves tear or stretch the axons of some neurons. This trauma is called diffuse axonal injury or axonal shearing. The damaged axons reduce normal brain function by
So as you can see, this is what happens when there's an impact to the head, neck, or body. You have the bouncing around of the brain inside the skull and the tearing of these axons. And these tearing, shearing, tearing, stretching of these axons, what creates the symptoms that arise in a concussion. And I'll talk about that in a minute. So this is an excellent image showing you the trillion of interconnectivity of wires, i.e. axons, in your brain. So as you can imagine, you've got information processing in speeds of 240 miles per hour. An individual conveys about 70,000 thoughts a day. Now, if that interconnectivity is broken, that's where you get a backlog of information. So your brain really is the only organ that cannot be transplanted, and it's the only organ that allows you to walk, to talk, to eat, to hear, to see. And we really want people to heed the importance of the brain. So I like to give an example of an earthquake. If you are driving on the freeway, say in Vancouver on Highway 1, uh, in non-rush hour, you can travel at normal speeds of 100 kilometers an hour, whatever the speed limit is. No problem. When there is rush hour, you get a bumper-to-bumper backlog, and you cannot go through. Now, if there's an earthquake, there's a fracture in the road and cars can't proceed, correct? So when there's a shearing and a tearing of those axons, you get that backlog of information, and then that's what your brain is seeing, and it can't process information, and that, depending on where the impact is to the brain, those are the symptoms that you experience. So your brain needs time to heal and repair those axons so that the information can once again flow freely as a fractured road that needs to be repaired so cars can then go through, if that makes sense. So, this is an excellent image showing you the interconnectivity and the intricate nature of the brain. It occurs from a rotational acceleration of the brain. So it's a forward, backward motion or a rotation of the brain, and it leads to what's called a metabolic cascade, and an influx and an efflux of chemicals in the brain, sodium, calcium, and potassium. And there's also a change in blood flow to the brain. So this is what happens when there's the shearing and tearing of the fibers. And it's really to this date uncertain where in the brain the concussion occurs or the exact origin of symptoms. Is it a particular point that gets triggered? Is it a certain area? Is it the frequency? Is it the intensity? There's so many variables. We've come a long way in the last decade to understand the brain, but we certainly have a long way to go because everyone responds differently to a concussion. I can have an individual who has a significant head-to-head impact, say hitting the ball in soccer, and the individual is fine the next day, versus say someone hitting their head on the trunk of a car taking out groceries, who is out for months on end. And that's where I say we don't know the exact origin. Why is that the case? Why do people respond so differently? There's also sex and gender differences in symptoms and recoveries, with females exhibiting more symptoms and having a longer recovery period. And the thought around that is perhaps biomechanics of female versus male, neck strength, shoulder strength, all those factors as well. And a lot of research is now being done in women, girls, and females in sport to try to understand a bit better what is happening. So concussions are a precarious injury. As I said, no two individuals will respond the same, and they need to be treated very individually. As previously thought, you do not need to have loss of consciousness to be diagnosed with a concussion. In fact, that only happens in about 10% of cases of concussions. There's a window of vulnerability to the brain that occurs during a concussion, and your brain needs time to heal from that vulnerability so that you can not have an impact on your quality of life and you can eventually get back to pre-injury level. There's no diagnostic criteria for a concussion, so there's no magic bullet, a blood test to say, yes, this individual, this one has one, this one doesn't. And on conventional imaging, X-rays, CT scans, unless there's a bleed to the brain or a fracture to the skull, it won't show you that that individual has a concussion. Higher resolution imaging in research does show changes to the water composition of the brain, but that's not feasible to do in the emergency department setting. So there is work being done to try to develop a diagnostic criteria for concussion, but to date, it's simply based on symptoms, history, and a whole bunch of other testing that's done in terms of balance, memory, etc. As I mentioned, symptoms can appear immediately or up to several days later. And that's very important because when someone is, say, playing hockey, they've taken a significant hit, they've been pulled out, they're asked a few questions, they seem fine, they're put back in the game. That's not necessarily the right thing to do. We recommend erring on the side of caution and just monitoring that individual for, say, 24 to 48 hours to see if symptoms do appear. Again, symptoms can last for days, weeks, or months, depending on the individual. We don't know why, but there is research that shows that the number of symptoms initially and the severity of the symptoms are indicative of the recovery period. So the more symptoms, the more severe is indicative that the recovery will take longer than necessary. And again, no two are alike. Specific to horseback riding, head injury is one of the most common types of horseback riding injury, either due to a fall or being kicked by the horse. This includes concussions and other craniomaxillofacial injuries that are occurring. And head injuries account for about 50% of hospitalization horse-related injuries. In terms of the statistic, it's estimated that 20% of young horseback riders will report an injury each year. Fractures account for 25 to 28% of all horse-related injuries seen in U.S. emergency departments, and concussions account for 9.5% of all show jumping injuries. Again, not all impacts will result in a concussion, and that's another important point. That's why you want to carefully monitor that individual for 2 days, and they may be completely fine. So what you need to do initially is immediate recognition of red flags. Is there neck pain or tenderness? Is there any seizures, fits or convulsions, loss of vision or double vision, loss of consciousness, increased confusion, weakness, numbness, tingling in more than one arm or leg, repeated vomiting, severe or increasing headaches, and increasing restlessness. Headaches are a big indicator. If the individual has a headache, closely monitor them that it's not getting worse, because that could be indicative of a slow bleed to the brain. And if any of these red flags are evident, then you want to go immediately to the emergency department and seek medical attention.
Depending on where your brain is injured, physical symptoms.
Sorry, I was going to say this is an excellent image showing you the physical, mental, and emotional symptoms of a concussion, but it really depicts where in the brain those are triggered. So I'll just start it here.
Symptoms of concussion may include headache, nausea, dizziness, poor muscle coordination, light sensitivity, blurred vision, ringing in the ears, slurred speech, and loss of consciousness. You may have mental and emotional symptoms, including disorientation, confusion, memory loss, inability to focus and concentrate, irritability, and
depression. So this is a really good depiction of where in the brain symptoms may be originating. And the reason it's important is because if you've got persisting symptoms related to any one of these, it allows you to really closely monitor and manage that particular symptom. So you want to be very symptom specific in your management. Now, depression and mental health is becoming more and more prominent in young children and young adults, because they can't function as they were pre-injury. They can't go out with their peers and have a good time. They can't go to restaurants. As an example, they can't function in their academics. And this is really important to recognize immediately within the first few weeks of the injury, and treat it immediately so that it doesn't get prolonged. Nope. There we go. Now, as I said, the good news is most concussions will resolve within 4 weeks, but you have a pocket of about 30% who may experience persisting symptoms, and they need very targeted multidisciplinary care. So, as an example, if someone is having persistent headaches and dizziness, as an example, likely they will need something called cervicovestibular therapy, which is manipulation of the brainstem, the neck area, because that part of the brain, the brainstem, is really responsible for headaches and dizziness as well. So, and nausea as well. So, we really want to be targeted in our approach to treating the persisting symptoms. Immediate recognition and response is critical to recovery, as I said earlier on. So you don't want to have a second or subsequent concussions that are more severe in nature. So you really want to follow the return to sport guideline that we've developed, and it's been developed as an evidence-based tool, and it walks you through each steps on what you should be doing at step one, when to progress to step two and subsequent steps, or when do you regress to the previous step, not to step one. If you're on step four, you don't go back to step one, you go to step three. But it's a very slow, limited aerobic activity, graduated return to activity. All our evidence on the concussion awareness training tool and everything we do are based on gold standard literature, one of which is the consensus in sport, concussion consensus in sport statement that happens every 4 years. Experts around the world come together to gather the latest evidence around recognition, diagnosis, treatment, and management of concussions. And then that information is collated and recommendations are made based on those. And we also have clinical practice guidelines for young individuals and older adults that really help physicians guide their treatment and care for patients. So these are really gold standard evidence-based resources that we use. So the field has been rapidly changing. As I said, we've come a long way in the last decade, but we have a long way to go. And to give you an idea, in around 2001, complete rest until symptom resolved was the guideline. Rest was the most commonly prescribed treatment for concussion. And now we know that that's not, exercise is actually quite good. Very slow graduated increase in limited aerobic activity is actually good. So you want to have relative rest for up to 2 days. And what I mean by relative rest is continue with your activities of daily living at a slower pace, as long as your symptoms don't worsen or you don't have new symptoms, or you don't do anything that could impact or have an impact on having another impact to your head. You really want to focus on active recovery. Rest for more than 48 hours may actually hinder your recovery, so we don't want people to rest beyond that. And isolation increases the risk for anxiety and depression, so we want you to get back to your daily activities in a slow, gradual pace. Further misconceptions versus facts. Back in the day, you were told, and unfortunately, some physicians still give the guidance to wake the patient up every 2 hours in the middle of the night. We don't want that to happen, because when you wake the patient up, you're waking up the brain within the first couple of days, and you're not allowing the brain to rest and heal. So increased sleep is normal and necessary in the acute stage, but not beyond 2 weeks. Lie in a dark room and avoid all activity. Well, we know we don't do that anymore, because that isolation gives rise to mental health challenges. So physical and mental relative rest is only advised in the first 48 hours. I've already mentioned you have to hit your head to get a concussion. That's not right. You can have a hit to the neck or body, resulting in the acceleration, deceleration, or rotation to the head. And you do not need to lose consciousness to be diagnosed with a concussion. So, as I mentioned, we really rely heavily on the concussion in sport group recommendations, the meeting that happens every 4 years. And I just wanted to quickly highlight some of the changes from our last meeting that we had in Amsterdam a few years ago. So, before it was only a physician or nurse practitioner could diagnose a concussion. That has been broadened to a licensed medical professional with relevant training, um, because it's hard to get into your physician. And we know in our province it's really hard. So if there's someone who is a licensed medical professional with training, that's okay as well. There's been changes to the red flags, and it's been updated on a concussion recognition tool that's available on the CAT. Persistent symptoms was revised to persisting symptoms, and now for all age groups. There's been updates to the sport concussion assessment tool, and there's a stronger emphasis on mental health and the recognition and management of mental health symptoms. Further, I've highlighted about rest, how we don't want rest beyond 48 hours, and it's okay to have mild and brief symptoms initially. You can still do your activities. Don't stop what you're doing. Try to get through those symptoms because doing your daily activities and exercise will actually alleviate those symptoms. Reduce screen time for the first 48 hours because of the pixels. That could give rise to sensitivity to light and cause headaches as well. We get this question all the time. When does my child have to stop playing? How many concussions is enough? And it's really an individual approach. There's so many factors that have to be taken into consider. The number of concussions, the severity and number of symptoms during each concussion. Has it been getting worse? Were there any anomalies in imaging if imaging was taken? Have you seen any behavioral changes? So it's really specific to that individual. And there's a lot of evidence to show the benefits of neuromuscular training in sport, as well as, in certain sports, the use of mouth guards and policy changes in the prevention of concussions as well. Sleep hygiene is really important. Consistent sleep schedule and duration of sleep may contribute to general recovery from a concussion and alleviate symptoms. So beyond 48 hours, try to go back to your regular sleep routine. Social networks. Previously, you were told stay away, but now we know that social interaction, as tolerated beyond the period of 24 to 48 hours, injury is actually really good for you. And to stay below the symptom exacerbation threshold and avoid risk for re-injury. If you're okay in social environments, it's okay. But if you find that your symptoms are getting worse or you're getting more symptoms, then you want to remove yourself from that activity. Screen time is a big question, and again, limit it within the first 28 to 48 hours, and then gradually increase it. But again, depending on your symptoms and the symptom severity. In terms of over-the-counter medication, we recommend in the first 24 hours, if you have a headache, not to take acetaminophen or ibuprofen because that would mask a slow bleed to the brain if there was one, and we don't want that. But beyond that, we advise to limit it and use less beyond 15 days a month to avoid around-the-clock dosing and to prevent overuse or rebound headaches. So for this part, I want to just summarize, not all impacts result in a concussion. So you want to really monitor the individual for up to 2 days. Early recognition and response promotes healing sooner. Light exercise actually supports recovery, as I mentioned, so you want to continue with that. No two concussions are alike, and it really requires an individualized approach to manage those symptoms. Treatment approach depends on the type of symptoms. I've already covered that. And gradual return to activity supports concussion. So these are the key take-home points I'd like to highlight. In terms of what's happening across the country, we've really come a long way. As I said, in the last decade, I mentioned Rowan Stringer. This was Rowan Stringer who unfortunately passed away in 2013. And as a result, we have National Concussion Awareness Week in our province with proclamations by our provincial government. We have webinars such as this and social marketing and social media campaigns. Ontario has Rowan's Law Day. They have an annual review of concussion resources for athletes, coaches, educators, and parents. Immediate removal from activity from any sport, and all participants and parents have to sign a concussion code of conduct. In BC, we have a lot of things happening as well. Our provincial government, Ministry of Health, really supports the education of concussion via the sustainability and maintenance of the concussion awareness training tool that I will talk about in a minute. And it includes partners such as the Children's Hospital, the BC Centers for Disease Control, Child Health BC, and many others. It's mandated, the concussion awareness training tool is mandated by sporting associations, independent and public schools, UBC Medical School, and SFU Athletics. And to give you some examples, it's mandated in over 450 member schools under the umbrella of BC School Sports for all their coaches, school coaches. It's mandated for all on-ice officials, 14,000 on-ice officials under BC Hockey, and we've got 56 universities and colleges across the country that have mandated it for their high-performance athletes at the start of every academic year. We also have our BC Concussion Advisory Network that contains members from over 80 members from government, non-governmental organizations, sporting bodies, our provincial sports teams, physicians, sporting associations, teachers, etc., that really come together twice a year to really talk about the latest of what's happening in terms of concussions in our province. We've got social marketing and social media presence, as I mentioned. This week is Concussion Week. And just recently, we developed, in consultation with Doctors of BC and our Ministry of Health, the GPAC guidelines for concussion. So all practicing physicians now have guidelines specific to addressing concussions with their patients. This is just to give you an idea of our social marketing campaigns. You can see the billboards in our major arteries across the Lower Mainland. We're highlighting concussions, billboards in buses and at the Vancouver Canadians field. And we just we have some marketing with the SFU hockey team as well. So around 2010, I started getting more calls in my office saying, what do I do? Where do I go? Who do I see? The teacher doesn't believe he can't focus and study. The doctor said he's had his bell rung. He'll be fine. And this coincidentally aligned with Sidney Crosby, who arguably around that time was the world's best hockey player, who scored the winning goal at the 2010 Winter Olympics here in Vancouver. So it received a lot of attention. So we really realized there was a disconnect on what people knew in our province around concussions. So we developed the Concussion Awareness Training Tool, or what we call CAT, to really address a gap in knowledge amongst various audiences a decade ago. What we did is we conducted an environmental scan, an international environmental scan, to say what exists out there. Does anything exist to inform and educate various audiences, from physicians to school teachers to parents to coaches? And nothing did. So what we did is we then conducted focus groups with all these audiences to say, if we build something, what do you want? So physicians said to us, we want the most amount of information in the least amount of time. We've got to be up to speed on all diseases and conditions. So tell us what we need to know, evidence-based, for caring for my patients. Parents said they wanted a one-stop shop to know how to manage their child. School teachers said to us, we want to know how to support our students. So we took all this information, and everybody said we wanted something free. We don't want to pay for anything. So our government said we will provide this free if we build this. And we don't want to make it only in the context of British Columbia, because how we treat and manage concussions in British Columbia should be no different than how they do it back east in Canada or across the country for that matter. So we built it, the Concussion Awareness Training Tool, with those in mind. Is accessing your screen? I think that's okay. So we've gone through 3 iterations, as you can see here, when we first launched in 23 on your left. In the middle here was our second iteration in 2018, and we update it to align with the Concussion in Sport consensus statement, because we want it to be up to date and have all the latest evidence. And I've alluded to the fact of how it's changing over time. And the image on the right is the latest iteration. And you can see changing technology, how the visual platforms have changed as well. So it incorporates the latest evidence and the research included in the International Consensus Statement of Concussion in Sport. It's available in English, French, and Spanish, soon to be Punjabi and Arabic as well, because they've mandated it in Beirut, Lebanon for their teachers. And the training is mandated in more than 110 organizations all over the world. And you can see we've got 8 modules there listed on the right. Depending on what lens you bring to it, you go to that module specific to you. It's evidence-based. It's built on the learner-centered model, as people like to learn by different modalities. Some like to read, some like to watch, some like to listen. And we found that out quickly in our focus group. So we've incorporated all those into the tool. It really has tailored resources to that specific audience. You get a certificate upon completion when you've taken the training. And if it's mandated, your organization gets a certificate that you've completed it as well. It's updated regularly. All modules have been evaluated because a lot of resource has been put into the development and sustainability of this tool, and we wanted to make sure it made a difference. So all of them have been evaluated to show statistical significance for changing knowledge, attitudes, and practices. And again, it's free of cost. So when you go to the site and say you click on coaches or athletes or parents or youth, it'll take you to this page here. It shows you how long the e-learning module is. It reviews the learning checks that you will know from taking the module, as well as the objectives of the module for completion, so your knowledge as well. We have a lot of other resources as well that were developed by request. So schools came to us, the film industry came to us for stunt performers and said, do you have a pathway that we can put up in our gym or in our studios? So we've really developed this pathway that allows someone to really understand what to do in the event of a concussion. And again, all these resources are on our website to print or connect with us to send them to you. We have return to school, work, sport, and activity cards that really show how to walk through each step of your management and recovery process. And another feedback we got is, could you have packages, printable packages? So if I don't have access to a computer, can I go to a package and see all the resources that I need? So we developed packages for all these modules, as well as what you need to know about concussions, medical clearance letter form, medical assessment forms, and our resource page on our website really repopulates based on the parameters that you select. This just shows you our reach, and we've been very fortunate in terms of relationship building, media presence, completions of the modules, the mandating. We stopped updating this because we were frequently updating the numbers, so we just cheekily added the plus sign to just avoid having to constantly keep updating this. And this is really to show you our global reach. So it's being taught in medical school in Japan. We went out to East Africa, Nairobi, and Tanzania and Uganda to do training for their medical professionals and teachers. We just completed training in Colombia and Beirut, Lebanon. And again, it's in our UBC medical curriculum, and you can see some of the publications that we've had as well. So in summary, what's needed is astute detection, accurate diagnosis, and optimal management and follow-up. So thank you very much for having me. I want to highlight and acknowledge my team. I'm really small here because it's really these three individuals that keep it going and up to date and responding to emails. So I couldn't do what I do without my colleagues Kate Turcott, Samantha Bruin, and Dr. Shazia Kermali, and the Digital Lab for all their help in building the tool and constantly ensuring its functionality. So thank you very much. And this is the URL for the Concussion Awareness Training Tool, as well as our profiles on Instagram and Facebook. And Samantha Bruin, our communications manager, really addresses all those injuries. So thank you very much.
The first question that I received was Megan asking the daily activities for an equestrian, and just wanted some clarification on those daily activities. Just because a lot of the daily activities means kind of going back to riding or working around the horses. So I don't know if you have any kind of clarification for that.
Yeah, so again, as I said, that the main mechanism for injuries in horseback riding is either falling off the horse or getting kicked by the horse. So in the first 48 hours, you don't want to be in a situation anywhere near where either of those two can happen. And then depending on your symptoms, you gradually want to get yourself back involved. But I would say if you do have symptoms, limited symptoms initially within the first few weeks, try to avoid situations where you could perhaps get kicked again. That could then make the symptoms worse or bring on new symptoms. And then you can then continue in participating to some degree, but just don't put yourself in a situation where that may happen.
Okay, perfect. Yeah, I think that helps clarify that. And then, yeah, if anybody else has any other questions, just don't see anything coming up on my end here. And if somebody wants to, oh, here we go. Brenda is asking, um, as a healthcare professional who is volunteering as a first aid provider during equestrian events for youth, what tools or resources should I familiarize myself with to best assist, provide care, and educate riders and or parents?
So I would recommend, Brenda, that you take the medical professional, the CAT for medical professional. It will give you the necessary guidance and information on what you need to do attending these events, and also gives you tools and resources that you may need for, say, an individual who has sustained a concussion. So it'll really well prepare you for that.
Perfect. Yeah, I think that is like such a fantastic resource and tool. And I'm so glad you brought it up today because I wasn't even aware that it was like, I heard of it, but I didn't realize how robust it was and everything. So that's fantastic.
Thank you.
Okay, perfect. And if anybody as well wants to unmute themselves and ask a question that way or raise your hand, you're more than welcome to do that as well. Um, I did actually, just while we're waiting for other people if they have additional questions, I was just curious myself about baseline testing. Is that still recommended for athletes?
So baseline testing is only useful in the 3 days post-injury. So that's the latest evidence because, you know, so the balance, so for instance, in baseline testing, there's balance, a balance assessment. Now, depending on, so let me give you an example. So when I brush my teeth in the morning, I've been given the advice to balance and stand on one leg while I'm brushing my teeth and then switch to the other leg just to increase my balance and mobility. And I can tell you on days that I haven't slept well, my balance is worse than it would be on a night, say, I've had a great sleep and I'm hydrated and whatnot. Baseline testing is used as an aid in making a diagnosis of concussion at the time and in the first few days post-injury to see your kind of trajectory. Is it getting worse? Is it getting better? But having a baseline prior to, say, a month or 3 months or 6 months before injury is not recommended anymore.
Okay, okay, that's good to know. Perfect. Okay, and we have a question saying, what are the ramifications to me for a rider or their parent not to follow the recommendations?
Well, I mean, the ramification is really your trajectory for your return to pre-injury level. You want to ensure that you return 100% without persisting symptoms. So it's really pivotal to, we get athletes who try to hide their symptoms for fear of not playing or being judged. But as I said, you've got one brain. It can't be transplanted. It's your quality of life, your information highway. Why would you want to jeopardize that? I mean, I say to kids all the time, would you rather be out for 2 weeks or 2 years? You want to return quickly and uneventfully and avoid being out for a year or two. So I think if I understood the question correctly, I think that would be the ramifications of prolonged symptoms.
Yeah, yeah, absolutely. Okay, Lisa is asking, as a fellow first aider, document everything. You do and say, if you have anything you can print out from CATT to hand out and then document that you did. Um,
Yeah. We do have an incident report form under the school professionals because that they wanted that. So if you go to the resource section and you just in the search strategy type that in, it should repopulate and show you the incident report form.
okay, okay, perfect.
Yeah.
Okay. Oh, and sorry, Lisa.
Oh, okay.
Yeah, she said she was just making a
Yeah.
comment there. Yeah, fair. Okay.
And certainly, I mean, if you think of any questions after we hang up on the Zoom, I'm happy to respond. Just drop me an email.
Oh, fantastic. Okay, perfect. Okay.
Well, it's unfortunate that you were hacked, Sarah.
Yes, I know that has not happened before, so I'll have to look into that a little bit further, and we'll have to kind of get some, I think, extra security measures going forward. So, yeah, we will definitely look into that. Yeah, well, thank you so much, Dr. Babul. I really appreciate. We also just had a question. Will the PowerPoint be sent out? Is that something you're able to share, or is that more kept personal?
I can, because there's video and imaging, it's a rather large file, but what I can do is I can see if they can save it here as a PDF,
Oh, yeah.
and maybe we can share it that way.
Yeah, that would be perfect. Yeah,
Okay.
awesome. Okay, yeah, no, that is perfect. Well, thank you so much, everybody, for attending today. And we will also, yeah, have the webinar recording if anybody missed it or wants to catch up. And yeah, thank you so much for spending your time with us today.
My pleasure. Thanks very
Great.
much for having me.
Yeah, thank you, Dr. Bibble. Take care.
Thanks. Bye-bye.
Bye.